Hello everyone, I'm Dr. Spoorti Kapate, pediatrician and neonatologist at Cloudnine Hospital, Electronic City. So first let me tell you what a preterm baby is. A baby who is born before 37 weeks of gestation, we take it as a preterm baby. A baby who is born before 37 weeks is not supposed to be born. The baby was not supposed to come out, the baby was supposed to stay inside. So sometimes it can be a little difficult to manage a baby as compared to a term baby. Depending upon the gestation of the baby, that means that depending upon how early the baby is born, the pediatricians or the neonatologists decide if the baby should be sent to the mother's side or should be admitted to the ICU, and the baby might need support. For example, if the baby is very small, born very early, which is 26 weeks, 28 weeks, 30 weeks, 32 weeks, obviously the baby would need to be admitted in the NICU, may need a little bit of respiratory support depending on how preterm the baby is. So I'm not going to go into the care of the baby for extreme preterm babies or a very small baby who we admit in the ICU. Most of the neonatal intensive care units have a guideline, and that depends unit to unit. Most of them admit babies born less than either 34 or 35 weeks or whose weight is less than 1.8 or 2 kgs into the NICU. Any baby who is above this age, that the gestation or the weight, they are shifted to the mother's side. Now, there are a few things that you need to take care of when it comes to a preterm baby. Preterm babies or babies who are small for their weight, which is low birth weight babies. A low birth weight baby is who is less than 2.5 kgs of weight. Such babies have low subcutaneous fat. So these babies are prone for hypothermia, which means that the babies might not be able to maintain their body temperature. So you have to look after that. So what you need to do is what we recommend generally is every 3 to 4 hours when you're changing the diaper, you also check the temperature of the baby. How do you do that? With the back of your hand, you check the peripheries and then you compare it with the tummy of the baby. Your peripheries is your hands and feet, and you compare the temperature with the tummy of the baby. If the temperature of the hands and feet is as warm as the tummy of the baby, then it means that the baby is normal. If the hands and feet is cold and the tummy is warm, it means that the baby is going into cold stress, which may eventually lead to full-blown hypothermia, which will eventually go there. So you have to make sure that you rub the hands and feet, put on socks and mittens, and put some warmer clothes on the baby. Make sure that in winters especially you use woolen clothes and not just cotton clothes. You have to make sure that sometimes even if the baby is wrapped properly, the baby might not be able to maintain the body temperature. In that scenario, you can do something called skin to skin contact or KMC to maintain the baby's body temperature. So what do you do here? The baby's naked body is brought in contact with the mother, and around them a shawl, or you can put a shawl or sweater or a blanket, and this way the mother is trying to give the warmth from her body to the baby's body. So this way also the baby's body temperature is maintained. So hypothermia is one thing. Second thing is feeding. Very important. Babies who are born preterm might not be able to feed like a term baby feeds. Why? Again, because the baby was not supposed to come out. The baby was supposed to stay inside. So feeding can be a little tricky in these babies in terms that the coordination between sucking and swallowing appears generally between 34-35 weeks. And if your baby is born at that time, you will notice that the baby doesn't swallow the milk properly. The baby might not latch at the breast. The baby might not suck longer. Even if the baby is sucking, might suck for like a few seconds and then sleep off. Or the baby might not finish the entire feed that the baby is supposed to take. So what we recommend is that you breastfeed the baby, and after that you pump out your breast milk using a breast pump or manually, and then you top feed the baby with the palata. This way you ensure that the baby has taken the adequate amount of feed. Because once the baby is breastfeeding, you wouldn't know how much the baby has taken. Like I said, the baby might not breastfeed really well. So you give measured feeds to the baby. And the third thing is infection. Very important. Any baby for that matter is prone for infection because their immunity is low. Preterm babies all the more. So you have to follow the same guidelines. You wash your hands with soap and water. You sanitize your hands. Make sure that who's coming in contact with the baby is healthy and not sick. And so the basic hygiene guidelines have to be followed. How to raise a preterm baby. I have talked about how to care for a preterm baby. Raising a preterm baby would be the same as a term baby. The only thing that you have to be a little vigilant about is the development of the baby. So at 3 months, 6 months, 9 months post birth, you make sure that the baby is either evaluated by a pediatrician or a developmental pediatrician to see how the development is going. And then every time the baby comes for vaccination and stuff like that, you can keep checking and monitoring the growth in terms of height, weight and head circumference of the baby.